Hello, my name is Len Berry, and I'm a professor in the Mays Business School at Texas A&M University, and I'm also a senior fellow at the Institute for Healthcare Improvement in Cambridge, Massachusetts. And I'm lead author of a new article called "When Patients and Their Families Feel Like Hostages to Healthcare," published in the Mayo Clinic Proceedings. I've co-authored the article with 4 other colleagues, 2 physicians, a healthcare strategy consultant, and another business school professor such as myself who does health services research, as do I. The article is about a concept we call hostage bargaining syndrome, HBS. As far as I know, it's the only time that phrase has ever been used in a medical journal article. And it's the only time that the word hostage has ever appeared in the title of a medical journal article. I may be wrong, but we've checked, and as far as I know, that's the case. And with good reason. It's a startling word. It's an unusual word. My gosh, hostage and patients and healthcare, how does that all go together? You think of hostages and you think of evil people capturing other people and treating them with ill intent. We use the word hostage in the article because patients often exhibit hostage-like behaviors even though there's no intent intended by the physician at all. Behaviors such as the patient's reluctance to question a physician about the treatment plan, even if the patient is concerned about that plan. Or the patient understating a concern that he or she has about the disease or the treatment plan. Or the patient asking for less than what the patient really wants so as to not be a nuisance. Patients, especially seriously ill patients, feel a great deal of vulnerability and they feel a great deal of dependency. And vulnerability and dependency encourage and stimulate hostage bargaining syndrome. So, where does it come from? It comes from this syndrome. It comes from patients often putting doctors on a pedestal. It comes from patients often presuming that doctors are the expert and they know best no matter what. It comes from patients' fear of jeopardizing the relationship they have with the doctor if they question the doctor or challenge the doctor, or even asking too many questions. It comes from the patient's fear of being labeled by the doctor once the patient leaves the room as a difficult patient. Hostage bargaining syndrome is an advanced case of what the literature calls white coat silence, where a consumer in a department store or in an airline terminal might be quite verbal, but in a medical facility or a hospital might lose their voice. We wrote this article to introduce physician readers to the concept of HBS, hostage bargaining syndrome, to how it manifests itself so physicians can recognize it, and to why it happens, to why smart, educated people, self-confident people can behave like a hostage when in the presence of a physician, especially when they're seriously ill, when they're vulnerable, when they're scared. If physicians don't address the symptoms of hostage bargaining syndrome when it first starts to appear in their encounter with patients, then hostage bargaining syndrome is likely to escalate to what we call learned helplessness, where the patient basically is ready to give up. And when learned helplessness arises, then shared decision-making, which patients and physicians want, which is likely to lead to the best treatment plans and medical outcomes, shared decision-making is effectively blocked. If you can see the symptoms of HBS early in the encounter and address them and encourage your patients to become full partners in their care, it's going to be better for everyone. Thank you so much.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.